Kyphosis being a overly perhaps rounded posture through the front. Lordosis, an overly curved posture through the low back. And scoliosis, where there's an actual postural distortion involving the spine being shifted over in one direction. I've had a lot of clients see me over the years who had one or more of these issues, and I've developed some tools that I think would be really beneficial for a lot of therapists today. So this is a little bit of lengthening through the pectoral fascia, where there needs to be length, a little bit of shortening where there could be a little bit more shortening here. So I'll do this in a variety of directions. If you don't have a massage chair like this one, you could certainly have some kind of a stool. That works just as well, as long as your client doesn't fall off the stool. From here, we're going to do a little bit of a shortening through our, and then coming back up. Okay, so those are a couple of our seated techniques we'll be looking at in the workshop. One thing which I really enjoy doing is getting a little bit of tractioning through the posterior side, through the suboccipitals, and getting some traction on the anterior side so that both sides feel supported, lengthened. I really like using my forearms as tools to save your hands, right? So we'll be using the forearms and elbows quite a bit in the workshop as well. This is a fascial lengthening through the posterior neck here. The idea being that when you get off the table, you'll just be a little bit taller. A little bit taller. Always a good feeling. So here we're going to be doing a little bit of passive lengthening through the neck, as well as a little bit of a fascial lengthening through the sternocleidomastoid muscle, the scalenes. This is going to be pretty superficial work, which will warm up for deeper layer work. But I find there can be a lot of good that can be done just from a myofascial layer before we get in and do any of the deeper work here. I love sideline work because it really opens up that whole lateral fascia in the body in a way that we can't really always get to when we do a simple prone supine session. So definitely like to integrate that, especially when somebody's having some shortening through that serratus anterior, bringing them into this kind of forward folded posture, right? Like, ooh, find some length. Resting right here. That's perfect. Serratus anterior goes all the way up to the very first or second rib. So to get to the space, we have to gently work into that axilla, into the armpit. Now I have a client who's particularly ticklish, so this has proved to be challenging, but we found with the use of a pillowcase, we can mitigate all ticklishness, or so it seems, right? Okay. Oftentimes it can be nice to get a little bit of extra breathing room, literally breathing room between the scapula and the ribs. All good here. So a little bit of distraction, a little bit of depression through the scapula as I come in and work into the subscap muscle. Serratus anterior a little bit here. Trying to get as close to that first rib as I can. without getting the ticklish response, always. Good. Now that we've worked as much of serratus as we can, this can be done with a rolled up towel or some small pillows. Even if you have a couple extra bolsters lying around, you could certainly use those. So now the shoulders are in a nicely aligned position from front to back. From here, I'm going to be working directly with the fascia over the C7 here, which is the 7th cervical vertebrae in the neck. Oftentimes we don't work the actual tissue over the vertebrae, but I found it's been really helpful for my clients to feel some extra looseness on that space. For folks with hyperkyphosis, there may be a tissue laydown that occurs here as the forward head is causing our body to respond and say, hey, we need some extra tissue here to help support everything. So I like to work that directly, and again, it won't be a deep grinding, deep tissue technique, but it will be felt on a deep level because of the specificity of the work. From here, I'll begin to mobilize the spinous processes themselves individually, just as we mobilize the arm, the hip, the neck. I like to mobilize these spinous processes a little bit to suggest there can be a little more freedom, a bit more movement between them here. After all, the body is mostly water, right? The majority of the body is water, so we want to remind our clients of that possibility for change, for movement, for freedom, when oftentimes we feel like rock, or like you were saying this morning, I believe the words were like a crumpled up piece of paper. You get out of bed and it's time to smooth out the paper, get a fresh new sheet straight off the printer. That's what we're doing. Bit of distraction through the shoulder joint as we compress into the rib cage. All this okay?
Yep.
And I would not want to forget about that, so I'm going to come in with a little bit of a loose elbow and work nicely in between the spinous processes and the medial border of the scapula here. And then slowly bringing us into a little bit of a lateral rotation stretch here. Let me know when you start to feel it. Okay. Okay. And we're doing a similar type stretch, but now with hands interlaced right behind the glutes. And again, let me know if you start to feel a stretch. So I hope you enjoyed some of these techniques, just a little sampling of really what we'll be looking at for that one-day class.